Thank you for coming along today to our prehabilitation knee class. The purpose of today is to allow you to meet some of the staff that will be involved in your care when you've had your total knee operation. Ask any questions that you might already have about the surgery. And from a physiotherapy perspective, it's a great opportunity to be able to show you some of the exercises that you will need to be doing after the surgery, because it would be good preparation for you to be starting some of those already at home. We'd also like to take the chance to show you how to walk with some crutches, because it's usual for a period of about 6 weeks after the operation to need a walking aid. And we could also show you how to do the stairs with those crutches. Okay. So when you've had your operation, Jim, one of the first exercises that we're going to be working at is trying to get the knee bending again. It's going to be very swollen and very stiff immediately after the surgery, and the doctors will need you to be able to show us that you can bend the knee to at least a right angle before we can make plans for home. So what I've done is positioned this sliding board underneath the leg, and you've got a little slidey ring underneath your heel to help the foot to slide. What I'd like you to do is keep your heel in the ring and see if you can draw it up towards you, so you're letting your knee bend up towards your chest. And just go as far as you can comfortably. Well done. Okay, and that would be about your right angle that you would be aiming for, and then relax it back down again. So after the surgery, we will be asking that you do this exercise a minimum of every meal time, and what we would aim for is a set of 10 repetitions. At home at the moment, if you could practice this exercise, it will help to maintain the movement that you've already got. Okay. Yes. So in addition to practicing bending the knee, it's also just as important to practice straightening the knee. Straightening is important because it allows the knee to be stable. When you're standing on it, we need the knee to lock out to be a good support for you. So each day we're going to be practicing locking the knee out totally flat. It's best to practice this with the legs supported up on a little roll towel like this, so all the support is taken away from underneath the leg. What I would like you to do is to try and press the back of your knee downwards, as if you're trying to squash onto my fingers, and take it down as far as you can. Well done. Hold for a second and then relax. And what you're looking for is the muscle at the front of the knee here tensing. You may feel a little stretch at the back of the knee, but that's a good stretch. Okay. The last set of exercises that we're going to do, Jim, are to practice strengthening the muscles at the front of the thigh. They're your quads muscles. It's important that those muscles are strong to give your knee stability when you're standing, and also to give you independence, so that when you want to lift your own legs, say getting in and out of bed, that you can do that using your own muscles. Okay. So this particular exercise is to practice lifting just half of the weight of your leg. I've placed a rolled up towel under the back of the knee, so this part of your leg is going to stay still. It's just going to rest on there. And the action is to try and pull the foot up at the ankle towards you, so your foot's at a right angle. That tenses the muscles in the lower half of the leg. And then in that position, see if you can slowly raise your foot up so that you're trying to tap my hand with your big toe. Well done. That's lovely. And slowly down again. That's perfect. I can feel that muscle working really well under there. It is important when you do that exercise to raise and lower as slowly as you can, so the muscle's always in control. Okay. Yeah. So this last exercise we're going to do, Jim, is called a straight leg raise. I'm afraid I've saved the hardest one till last. This is something that people do generally struggle with immediately after the surgery. It can sometimes take a day or two to master it. So it's worthwhile me showing it to you today, so that you can go home and be practicing it, so that you know what we're aiming for after the operation. It's basically similar to that first exercise with the rolled up towel, but this time we're going to try and lift the whole weight of the leg. The start position is a little bit different. I need you to press the back of your knee down as flat as it can go first, and also bend at the ankle so you're pulling your toes towards you. Okay, so that's the start position, as flat as you can, and then see if you can lift up those few inches to tap my hand. And nice and slowly down again. Well done, that's perfect. Jim, this is a copy of the exercises that I've been through with you today. What I'd like you to do is start in preparation for your surgery to get into the habit of doing these exercises every day. When you've had your total knee replacement, we do recommend that you do the exercises every meal time, a good set of 10 repetitions of each. So it would be good if you could start to practice that. The exercises are also in the knee booklet, the information booklet that will have been given to you already. Okay.
Thank you.
When you're walking with the crutches, Jim, we want to try and create as normal a walking pattern as possible. So what we would suggest you do is use the crutches as a buddy for the poorly leg. So we're going to always have the crutches either side of the to be operated leg. If you go forward with both crutches together and then step with your left leg and see if you can come through with the better leg. So that's it. 2 crutches, poorly leg, better one through. Well done. What I would like to do next, Jim, is show you how to stand up and sit down when you're using crutches, because there is a special technique. Basically what we want to do is minimise the risk of you damaging your arms from having your arms still trapped inside the loops. So the golden rule is that your arms should never be in there when you stand up or sit down. If we crisscross the 2 handles to make a H shape, it's then possible to hold them with just one hand. So if you want to hold through there, that gives you a free hand now to push up from your base that you're sitting in. So if you come up into standing, and then only when you've got your balance, can you bring your crutches round in front of you and thread your arms into the loops. Okay, handles should always point forwards, and then you're ready to go. Sitting down is going to be the opposite. So we're going to now bring the crutches round in front of you to thread your arms back out of the loops. So go back to holding them in one hand. Maybe just move them out the way of your feet a little bit. And then again, you can feel back for the chair and slowly lower. Well done. That's perfect.